I'd like to talk now a little bit about the end feel when you're trying to work with range of motion of a joint. In terms of end feel, what we need to do is understand the difference between a leathery end feel at the end of the movement or a bone-on-bone end feel. In terms of treatments, when you want to do a treatment, you have to understand what you want to accomplish. Is it working on the muscles or is it working on the joint capsule? So in terms of the pelvis, what we want to do is we want to check the range of motion. So the person probably would be supine or prone, doesn't matter necessarily, and we're going to check the end feel of internal and external rotation. So the internal rotation should be 45 degrees and leathery type of feel. If it is not 45 degrees, say 30 degrees, and more of a bone-on-bone type of end feel where it's an abrupt stop, what we want to do in terms of treatment is joint capsule work, which we're going to be showing you in this video. In external rotation, it should be 60 degrees and a leathery end feel. For example, if it's not 60 degrees and an leathery end feel on external rotation, we need to do a joint manipulation as well, the mortal and pestle, okay? So again, regarding end feel, we're looking for the end feel of the ranges of motion. So internal rotation of the hip or femur will be 45 degrees and leathery. If it is not 45 degrees, but still a little give in it, then you may want to release the gluteals or other muscles that would release those tissues. On external rotation, it should be 60 degrees and leathery end feel. If it is not 60 degrees and leathery, if it's a bone-on-bone feel, then we want to work the joint capsule. Because as the joint capsule wraps around, sometimes we get adhesive capsulitis, which would cause some tightness in the hip. And a lot of times people just stretch and move the joints around, but we need to go deeper and access these tissues deeper. So we're going to do a mortal and pestle. We're going to take the femur and we're going to go in against the way that the femur does not want to go. So in terms of external rotation, if you do not have 60 degrees and leathery, say it's 40 degrees and bone-on-bone feel, the end feel, we're going to work that inside the joint, and we're going to be accessing those fibers on the inside, the fascia on the inside, to release that with the joint pushing it in, the mortal and pestle. Then we're going to do a capsular stretch and then traction. So it's rotation, capsular stretch, and traction.